Resting against your windpipe is a small, butterfly-shaped organ called the thyroid gland. It functions as the hidden metabolic engine that drives almost all of your body's energy. This gland secretes hormones that dictate how you process proteins, fats, and carbohydrates while regulating your body temperature and heart rate. Even though it manages these critical systems, up to 20 million Americans suffer from a thyroid malfunction, and a massive portion of them remain unaware of the cause. The signs of a malfunctioning thyroid are notoriously difficult to track. Symptoms range from profound fatigue and weight gain to severe anxiety and sudden weight loss. Because these external symptoms pull the body in such opposite directions, they are frequently misdiagnosed as chronic stress, the normal aging process, or psychiatric issues. A catastrophic breakdown in this tiny 2-inch organ causes systemic chaos that ultimately disrupts the entire human body. The chemical instructions for this metabolic loop begin in the pituitary gland, located within the brain. This diagram shows the signaling pathway. The brain releases TSH, thyroid-stimulating hormone, which travels down to the thyroid gland in the neck. TSH tells the thyroid to produce the active hormones T3 and T4, which then enter the bloodstream to fuel body cells. As long as this communication loop remains unbroken, metabolism functions at a steady, healthy baseline. When the thyroid begins to underproduce these hormones, the body falls into a state called hypothyroidism. The most common cause is Hashimoto's disease, an autoimmune condition where the immune system mistakenly attacks and damages the thyroid tissue. As hormone levels drop, the body aggressively slows down, leading to extreme lethargy, unexplained weight gain, a low heart rate, and an intolerance to cold. This illustrates the brain's desperate response. The pituitary gland pumps massive amounts of TSH to force the failing thyroid to work. This results in a specific biochemical signature. A blood test showing high TSH combined with low T4 is the definitive marker of hypothyroidism. This chemical imbalance reveals a structural mechanical failure. The metabolic engine simply cannot respond to the brain's frantic commands. The loop can also swing to the opposite extreme. In hyperthyroidism, the gland becomes overactive and produces an excess of hormones. Autoimmune conditions like Graves' disease or the development of toxic nodules force the thyroid gland into an uncontrollable overdrive. This acceleration causes a rapid and irregular heartbeat, sudden weight loss, noticeable hand tremors, and severe anxiety. The brain reacts to the hormone surplus. Sensing excessive T3 and T4 in the blood, the pituitary shuts off its TSH signal. This produces an inverted diagnostic pattern. A flatlined TSH level, combined with high T3 and T4, proves the presence of hyperthyroidism. In this dangerous state, the body's internal engine becomes a runaway train, speeding forward without any regulatory brakes. Resolving these systemic imbalances begins with a blood test to measure the exact chemical levels of TSH, T3, and T4. To treat hypothyroidism, doctors prescribe synthetic daily hormones to replace the chemical fuel that the damaged gland can no longer produce on its own. Hyperthyroidism requires the opposite approach. Doctors must suppress the overactive gland using antithyroid medications, radioactive iodine therapy, or surgical removal. No universal cure exists for the underlying autoimmune disorders, but these highly targeted medical interventions can recalibrate the biological feedback loop. By deciphering the hidden chemical language of the thyroid, patients can translate chaotic symptoms into precise solutions, allowing them to reclaim their metabolic health and physical balance.